Hello, my name is Susan Stedman. I'm a registered nurse with 12 years of ICU experience, and I am the spokesperson for New Zone Medical. I'm here to introduce to you today the world's only adjustable oropharyngeal airway, the Dual Air. One of the most important innovations of this airway is that you no longer have to select from an array of airways in an emergency situation. With the Dual Air, you choose one airway that lets you adjust to your needs. For sizing, the package has an easy sizing guide, or you can hold the airway up itself and size the airway the way you've always been trained to size an airway. Let's talk a moment about the physical features of this airway. There's three main components to this airway. This is the palatal arch. It lends stability for this airway. This is the movable, adjustable tongue deflector. And then, of course, this is the bite block region of the airway. Insertion of the Dual Air is simple. It's the way you've always been taught. 90 degrees. Take the palatal arch past the teeth. Turn 90 degrees and click until you have a patent airway. New Zone Medical has addressed the most important issue in airway placement, and that is having airway clearance. A standard 14 French catheter is easily used in the center port of this airway, easily suctioning fluids and debris from the back of the oral pharynx. And a standard Yankauer suction is easily used around the device as well, from either side. And you're able to get all the way to the vocal cords with a standard Yankauer without moving or disturbing the patency of your airway. Similarly, it's just as easy to suction a pediatric size with a 14 French catheter, with the ability as well to use a standard Yankauer suction, again, because of the port design of that palatal piece of this airway. Let's talk about ventilation. Bag valve mask ventilation in the past has always been a problem with a traditional airway. The Dual Air's port design is so large and so patent that the resistance has been lowered. It is easier to deliver a breath. And because that resistance is lower, that air is going into the lungs easier. You're decreasing gastric insufflation and the real risk of aspiration. Once your airway is placed, it must be secured. Many times you're working solo and your patient wants the airway to come out. You want the airway to stay in. So New Zone has made available a Velcro device that helps to stabilize your airway and keep it safe and secure. So your patient has become more alert and you want to change to a non-rebreather. The Dual Air comes in 5mm half-step adjustments on the tongue retractor so that you can fine-tune that tongue placement just where it needs to be and everything fits.